15 children you won't believe actually exist. 15. Baby with congenital arrhythmia. Congenital arrhythmia means being born without a nose. This also means that the child was born without a sense of smell. It is a rare condition. This little girl was the first child to have a nasal implant placed where her nose should have been for cosmetic reasons. Though she will never develop a sense of smell, she will suffer less teasing from her peers in the future with the implant in place. 14. Fraternal twins born with different coloured skin. These two girls look totally different but were born to the same mother only 1 minute apart. Though this was almost unheard of 20 years ago, there have been quite a few documented cases recently. These two beautiful little girls demonstrate so well how two different children created and grown together can turn out to be with the power of genetics. Usually, people with dark skin hold more dominant genes than people with light skin. This makes this occurrence even more curious. 13. Cone head deformity caused by Agent Orange. Agent Orange is a chemical weapon that was used by the military in the past. Most of the cases of enemy exposure occurred during the Vietnam War. The effects to children are drastic deformities that are not reversible. The child in this picture was 5 years old. The cosmetic changes appear drastic, but his intelligence and emotional levels were not as drastically altered. Unfortunately, many children were changed forever by Agent Orange. This is why it was recently banned for use by the United States military. 12. Child with vitiligo. Vitiligo is a skin condition that causes the loss of pigmentation in certain parts of the body. Doctors have been unable to pinpoint exactly what causes it. Research has found that it can be caused by chemical contact, autoimmune diseases, oxidative stress, and genetics. This adorable baby has vitiligo on over 50% of his face. Some people with vitiligo will attempt to even their skin tone to one color with skin bleaching, but this is of course not recommended for children. 11. Child with extreme cleft palate. The cleft palate is also a common deformity and usually it is easily fixable with cosmetic surgery. This child, however, has a growth protruding from his nasal cavity. This will seriously inhibit the possibility of cosmetic surgery. Removing the growth and fixing the cleft palate would enable better breathing for the child, but he may never be able to qualify for the surgery. 10. Child with hypertrichosis. Hypertrichosis is a condition that causes hair growth over the entire body. It is a genetic condition and is often called werewolf syndrome. This rare condition does not have many treatment options, especially for children. Oftentimes, whole families will have hypertrichosis. This is better because children with conditions like these can suffer extreme bullying by their peers, causing emotional damage. 9. Child born without a sternum. The sternum is better known as the breastbone. This child was born without a sternum, causing difficulty breathing. This condition is extremely rare and will cause lifelong problems with breathing, digestion, and growth of the torso. When this child is older, it may qualify for the insertion of a prosthetic sternum if it lives to be old enough for the surgery. Children with abnormalities like this have a high chance of SIDS and sometimes do not make it past the first year. 8. Conjoined twins who survived separation and prospered. These twins were born conjoined at the stomach. They were great candidates for separation because all of their major organs were separate. The twins were successfully separated and were able to function as any normal children would once they were fully healed. With improving medical technology, the chances of success after separation are high, depending on the extent of the organs shared by the twins. These two were very lucky and only really shared skin and nerves. This made their separation much simpler than most. 7. Child with hydrocephalus. Hydrocephalus is caused by an overproduction of spinal fluid that builds up, causing the skull to stretch. This gives the skull a bulbous and veiny appearance. This condition is usually congenital, but is sometimes acquired later in life by environmental factors. 6. Boy with elephantitis of the legs. Elephantitis is the swelling of body parts caused by inflammation. This may be caused by environmental issues, genetics, or trauma. In this boy's case, he contracted it from a flesh-eating bacteria. He is bound to his bed and cannot wear typical clothes because his legs are too wide. He is a 10-year-old from Uganda. 5. Boy born with extra limbs. This young boy was born with a set of legs and 2 small arms growing out of his stomach. Cases like these almost always result from the presence of a parasitic twin. The more dominant twin will absorb the other in the womb. In some cases, the twin is only partially absorbed. 4. Little girls with microcephaly. Microcephaly is the occurrence of a smaller than normal head. This condition occurs when the baby's brain does not develop properly in the womb. Sometimes it occurs on its own, and sometimes it is accompanied by other birth defects. In the case of these two little girls, microcephaly was caused by the Zika virus, which is contracted by certain types of mosquitoes. 3. Baby with rose-colored birthmark. This type of birthmark is commonly called a port wine stain and is caused by a vascular anomaly of the area. Usually, this kind of birthmark occurs on the face, like on this baby, but it can also occur on the neck and upper trunk. In early life, the birthmark is usually bright pink or red and darkens to a wine color with age. 2. Child with cyanomelia. Cyanomelia, also known as mermaid syndrome, is a congenital deformity of the leg. In these cases, the child is born with the legs fused together. More often than not, children born with this deformity do not live more than a day or two due to lack of proper organ development. There have been a handful of children who survived and also underwent surgery to separate the legs. Though the surgeries were successful, the children have complications with waste disposal, the frailty of bones and muscles in the legs, and kidney malfunctions. The two most well-known cases of cyanomelia separation resulted in early death, one at the age of 28 and the other at the age of 10. 1. Child with parasitic twin attached at the head. Conjoined twins are more common than many think, and unfortunately, they usually share organs. This makes separation nearly impossible. In this case, the child with only half of a body is considered a parasitic twin because it only survives off the life of the other. Separation of this type of conjoined twins is possible, but the removal of the twin who has no motor functions is controversial because the other child does not have the ability to survive on its own. Though these children were born different than the average child, their uniqueness makes them special. Have you known any children with unusual qualities? Tell us about it in the comments below. We hope you enjoyed our video. Don't forget to like and subscribe to our channel. Thanks for watching.